Welcome back, everyone. I hope everyone's had a good break and had a chance to see Dion's visual illustration. It looks really great. So we're going to start our second session about evaluation and sustainability, and that will be chaired by Injonge Karanwa from the Global Health, the Global Health and Public Engagement Fellow at the University of Global Health Equity, Rwanda. Thank you, Injonge.
Thank you. Good afternoon, everyone. I don't know where you are in the world. I'm in Kigali, Rwanda. It's the afternoon, so it's a pleasure to be connected. So, as mentioned, I will facilitate this second session that will explore evaluation and sustainability in our field. So what will happen, there would be different section, one that will look at measuring impact and success, the second one making positive change in communities, informing policies, change in practice, right? And then just after, we'll have a plenary discussion where we will ask you to contribute on what's the commitment to action, what's the change that you want to see in our field. So that would be good that you, as we go through this together, that you start thinking about it, take your little notes, so that we'll be ready to share with each other at the end of the session. So yes, we have about 5 minutes. So I will share a bit about yes, Mesa. So and the project that we're doing, it's a Hamwe Festival. I really encourage you. I will put some links a bit later in the chat, so that you can see. We had a third edition that was just finished recently, and we looked at the at building a collaborative platform from the creative sector and the health sector in order to generate health outcomes. So we are going from therapeutical projects to health communication, different type of public engagement activities. So I'll be happy to discuss that a bit more later. So Beatrice, I don't know if you are ready. If you can.
I am ready. Let me share my slides.
Yeah, okay. So Beatrice, over to you, and thank you very much. Right?
Thank you. Can everyone see?
Yes, we can.
Okay, great. Thank you. Good afternoon, everyone, and thanks for the invitation to come and speak to you all. I am going to chat for a few minutes, so please keep an eye on the time and just tell me if I'm over talking. So I'm going to be sharing about monitoring and evaluation and working with civil society organizations. So really sort of using, impact measurement and management to monitor progress and inform how programs run. So the case study I'm going to be using today is the Solidarity Fund Food Relief Program that was carried out in 2020. So just a bit of background for you, that those of you who don't know about the Solidarity Fund. It was created in 2020 at the onset of lockdown in South Africa. So in March 2020, as a platform for all South Africans from the public and private sectors, civil society, as well as the general public, to unite the nation in our response to the COVID-19 crisis. So really the fund, and what was different about it, it was designed as a rapid response vehicle that aims, and it still does, it's still continuing well, to support various government and non-governmental organizations in the prevention, detection, medical care, and humanitarian support during lockdown and beyond. So really, I am my own consultant. I run a small consultancy called Beatrice Watermeer Consulting, and at the time I was consulting to Chikalulu Social Investments, and alongside other service providers. It offered the Solidarity Fund its services pro bono, during this time to help run the emergency food relief program. So I'm not going to go too much into detail because today's more about the impact measurement and management of that program, but really just to give you an overview, this was the Solidarity Fund's first disbursement, and it was announced on the 18th of April 2020 in the form of 120 million Rand funding commitment to provide emergency food relief to over 250,000 distressed households across South Africa. So obviously, you know, we've all been through our lockdowns and we understand the costs of, you know, families suddenly being halted in their work and travel, and, you know, the vulnerable became even more vulnerable. So really it was targeting the most vulnerable, marginalized and rural families, and those experiencing severe food insecurity during the lockdown period, but while being able to observe the rules of the national lockdown. And it was designed as a stopgap measure. So really, you know, before other government interventions could get into place. And the food parcels provided a basic food relief for a household for 2 to 3 weeks, so depending on the household size. And as I say, it aimed to reach 250,000 households, and there were 4 pillars to the program. So the first pillar was reaching households through the Department of Social Development, through their community nutrition development centers. The second was reaching households through 4 large NGOs, MPOs, with a track record of being able to deliver food across the country. Then the third one, which was a very important one, was the fund did a lot of work in identifying the critical gaps in coverage in the vulnerable areas. And this was part of working with community-based organizations to reach out to the most vulnerable and rural areas. So really the last mile delivery, and this pillar was so important because a lot of it was big trucks coming into areas and being, and really the last mile, actually a lot of trekking and putting on buckies to get to these really vulnerable areas. And then there was the next one, which was pillar 4, which was reaching households through food vouchers. And so the 4 pillars acted to all at once. And really sort of our role in this was we were given the role to manage this. So not only implement the program with alongside other partners, but also to monitor the program. So really here, and you know, this afternoon, you'll be talking a lot about different forms of monitoring and evaluation frameworks or impact measurement and management frameworks. But within what we were doing, we used the Social Value International framework. So there are 4 stages to this, which is planning for impact, collecting evidence, and analyzing evidence and reporting and improving. So, and then within, so as you'll see, it's depicted by a cycle. And this really speaks to the practice of continual evaluating and learning. And then linked to this are the 5 dimensions of impact, which you need to ask yourself when you are measuring and managing programs. What are the outcomes occur and how valuable are they? Who are the stakeholders that are experiencing them? How much change they experienced? Your contribution to these changes and the risk that you do not create as much impact as you want or you require. So moving on, sorry, my slides. So moving on. So as I'm taking you through today, as it's a brief presentation, but I'll take you through each of the 4 parts of the IMM framework. So as a first step, we had to plan the impact. So this theory of change that I'm presenting here was developed by the Solidarity Fund and Chikalulu Social Investments and showed the 4 pillars of the Solidarity Fund. So prevention, detection, medical care, and humanitarian support. It shows its activities that the fund intended carrying out and the short to longer term outcomes and the impact that the Solidarity Fund. So the impact of, impact statement of a Solidarity Fund is that the fund will have effectively and meaningfully contributed to South Africa's ability to respond to the COVID-19 pandemic. So as part of this, we put this together, and this is publicly available at this following link, which I can share after the meeting. But really, we also put in indicators that we could use to measure this theory of change. And the part highlighted in pink is what I'm speaking to directly today. So it was about the humanitarian support, and the logic was that if we provide emergency food relief for newly vulnerable households due to the pandemic, then we will reduce the rates of undernutrition and starvation for the most vulnerable, which will strengthen the short-term emergency safety net for South Africa's most vulnerable and bolster their ability to weather the storm created by the pandemic. So that was our planning impact stage. Then we moved on to the collecting evidence. So this, I think it's hard to describe how intense this program was. There were a number of organizations, as you can see by the pillars, across each of the 4 pillars. And every single organization involved in the effort had to report every 2 days. So quantitatively on how many food parcels they're delivered by area, town, and village. Then this had to be accompanied by qualitative data, which included challenges, successes, photographs, video testimonials, and any other information they wanted to provide. So, it's important to just remember this is an emergency program, and, many of your programs will be a lot slower than this. So, it's not the sort of absolute emergency that the Solidarity Fund needed to see reports every other day, that we were working all night and all day on this. But really, this sort of gives an overview of what it was like. And it was a huge team, and there were people deployed in provinces, making sure that everything had been delivered correctly, et cetera, et cetera. So we submitted the reports to a specific inbox, which was manned by a team, and this team were allocated the specific projects or the specific organizations. Then these reports were cleaned up and sent to me. And then following this, I captured this quantitative data into a huge spreadsheet. And what I was responsible for was logging each, set of parcels per area, town, village, and local municipality. So I've blocked out the names here, obviously, for privacy, but if you have organization number 1 here, on the 21st of April, in Richards Bay, they delivered 1,500 parcels. And within this, we had to then log each local municipality, district, and province. And this was critical because we needed to correctly feed into Google Maps. So, for example, if you put an East London in and you haven't got the correct municipality or district, it'll show you East London in the UK. And especially, I think one of the huge challenges of the program that I experienced was that some areas and villages in South Africa are so rural and new that they don't actually exist yet on Google Maps. So often and my husband and I sat up for many nights tracking down where these tiny areas were in the closest municipality and the closest district, so that we could make sure that the map was correct. And then alongside this, the qualitative data was stored on Chikalulu systems ready for analysis. So then now we move into the analyzing evidence area. So really all this quantitative data was put into a pivot table, and on every other day, we did a descriptive analysis report, which showed the breakdown of food parcels per province, the breakdown of food parcels per pillar, and the breakdown of food parcels per area mapped on Google Maps. So I'll show you what the Google map looked like. But the purpose of this Google Maps was not only to show the Solidarity Fund where the parcels were being delivered, but also where they weren't being delivered, so that we could see, are we, for example, in the Northern Cape, we're missing out a lot of areas in the Northern Cape. Then there was the qualitative data analysis. So a lot of this was gathering themes in order to identify the successes, the challenges, early outcomes. So understanding the impact of the project. So this is based on, feedback from the end users, case studies, and key lessons. And I think especially around delivery, And when I say delivery, I also mean security of the delivery. A lot of people started out, for example, delivering to people's houses. And one such example got almost started a riot. And, you know, I think we didn't realize the sort of impact of the hunger, et cetera, et cetera. And from then on, after that, they distributed from creches and churches. So it's those sort of things that we're learning. And I guess, you know, now this flows into the reporting and improving. So as I say, this consolidated report was required by the Solidarity Fund 3 times a week. And for us to be able to problem solve around the delays and security of the participants. And I think, you know, what I'm sort of trying to get to, which you'll be going into detail this afternoon, is really these continual reports and this continual impact measurement and management showed us how we can continue, how the project could continually improve. And I've already mentioned, while most interventions wouldn't require this on such an extreme basis, this case study demonstrates the cycle of continual impact management, and it can continually guide the program to be better, so that you are completely problem solving as you're going, and the next day you're doing something differently. And whether this happens on a quarterly report, you know, quarterly for your organizations, we just had to do it in a very short space of time within 6 weeks. And then I think sort of just finally, as I say, I haven't got much time today to go into more detail, but this is really where we got to. So as of the 30th of November 2020, when we submitted our final report, we had managed to reach over 300,000 households through food parcels. And these are all the pillars that, and as you see, pillar 3, a very important one, reaching the most vulnerable areas, managing to get 69,000, and our NPOs. So, you know, what was interesting is that the NPOs, so although there were 4 NPOs, they also had loads of partners. So it's almost like pillar 2 and 3 merged in a sense to reach the most rural areas. And then as of the 30th of November, this was the breakdown per province. And KZN and Eastern Cape, you know, you'll see along here. Interestingly, KZN and the Eastern Cape were the areas where there were just a lot of new developments and a lot of new areas that cropped up that Google Maps hadn't yet mapped, as I've already explained. And then this really was the final piece, the sweat, blood and tears that went into it. And when you actually do go into the Google map, which the Solidarity Fund has access to, if you scroll, then you can click on each of these towns. Sorry, I've now taken you out of here. Each of these towns, and actually find out in each of these teeny weeny areas how many parcels were delivered into those areas. So that's really a very this is a very quick overview of a case study, and I will hand over to the facilitators to ask me questions.
Thank you. Can you all hear me? Yes?
Yep, we can.
Okay, perfect. Okay, so there are some questions. You're welcome to add some more. So Alice Curry, I would learn a lot from a second slow. Hello, hello. Okay, so maybe Rachel, do you want to ask your question? You can unmute.
Hi, yeah, no, that was a really interesting presentation, and I guess it really helps to think about, you know, how we develop these systems that are responsive to shocks like COVID. So I'd be very interested to hear a bit more about how this monitoring system also linked up with the work of the Department for Social Development, to really understand which households were getting a combination of things like child grants as well as the food packages.
Yes, I mean, the Department of Social Development was obviously they were pillar 1 of this program. And I think sort of what I neglected to say was I suppose I didn't have, I didn't have time, was the back work that went into identifying these households. So a huge amount of mapping was done up front by a lot of stakeholders, economists, et cetera, to map those households, to ensure that it wasn't sort of, we weren't double sort of sharing in households. I think that's what is that what you're trying to say, to make.
Yeah, it's partly about targeting, but also I think there's a lot of interest in how, obviously when there is a shock, people might need more support. So it may be appropriate to get additional support on top of a basic grant. But whether it would be, just interesting to see the sort of coverage data of those people who are getting food parcels and, say, child support. I mean, will this system allow us to be able to see that type of layering of support?
So that layering was definitely done. I think, Rachel, it's whether I can share it or not, and I don't think I have permission to.
No, it's fine. Yeah.
I would recommend you go onto the Solidarity Fund website. A huge amount of their data is public, hence why the impact framework and pretty much what I spoke about today is all public knowledge. And I think also they would be very open to sharing that kind of information, because a huge amount, I have sat through the presentations where that layering was done. We just got involved more in the implementation side, but the upfront work had been done by the time we took over the reins. So I would reach out to them if that does interest you, because I'm very sure they'd be happy to share.
Great, thanks a lot.
Okay.
Okay, so you can continue putting your questions there. We'll start with the next presentation, but for the questions that were not addressed, we will address them in the final discussion. So thank you for your questions. And at this time, I wanted to know if Ilona and Mona, you could hear me?
Yes.
And if you could be ready. So maybe Rachel, you can end sharing your screen, and then that would be Ilona and Mona's turn. Beatrice, sorry, hello? Or maybe the Zoom coordinator could do that.
Sorry, no, I should stop share. Sorry, there we go. It's up better now.
Thank you. And thank you so much for your presentation. Over to you, Ilona and Mona.
Thank you. Thank you, Mona, for sharing slides. And Mona and I are going to tag team this quick overview of a presentation representing the work of quite a large team based primarily at the universities of Oxford and Cape Town. And our goal is really to come together, as the next slide shows, in different communities, and to connect, not just collect really good quality data and methodologically sound, using mixed methods and large data sets, but to also come together and think, what are the most pressing research questions from colleagues who are implementing, from colleagues in government, where are the funders thinking the future needs will be in several years' time, and then the academics to come together and think, how do we analyze the existing data? And really engaging and including and talking and thinking around what their questions are and what we can do with our data is really at the core of our work, which is why actually Mona and I are together. Her role focuses primarily more in the outward facing and connecting with colleagues like you and in government and UN agencies. And my role focuses on supporting a team of quantitative primarily, but also qualitative researchers. What we want to share with you for the rest of our 8 minutes, you can move on, Mona, presentation, is how we're thinking about bringing together different data sources. And our goal, and a lot of the data that we have, points to the need to build systems that support safe transitions to adulthood. So what we've actually been doing, and this slide may look we'd love to hear your thoughts on this slide, but this is the summary of potentially, about 20 or 30 different sets of analysis, where as we analyze data from, say, a study that focuses on the early stage, on this little crawling baby on the left and the toddler, we kind of figure out what it takes to support and maximize the outcomes of a young person or a child. But importantly, the data that we're now collecting and analyzing is helping us think, how do we move from, in each stage of life, what is necessary to continue at each stage of one's life, and what are additional and enhanced programs that should be added. What is obvious maybe to those of you who are looking at this for the first time is that one needs more than one kind of program and intervention. And that's actually something that it may seem so obvious to all of us. But if for a long time, a lot of our programming was trying to say, if you just do this one thing, you will address kind of this one most important thing. So what we're doing as a team, and this was really listening to young people and also government partners who are saying, but I don't think on a one-to-one basis, is to say, what are 1 or 2 or 3 things we can combine? But most importantly, how do we think about how these programs, for example, you'll see in gold or orange, it's a cash transfer. So in South Africa, we have the child support grant and pension grants. In other countries, they may be called different things, but they may be conditional or unconditional. But what we're trying to do as a team is to think, how do these combinations? And initially we had to do it for each individual intervention or program, but now we're thinking, how do these programs come together to impact not only more immediate things like HIV infection or risk, which was some of our early work, but also aspirations, staying in school, good mental health, reduced feeling more empowered, if we're thinking about long-term sexual and reproductive health, no hunger, and a few other, and reduced exposure to violence where possible. So this is, and how these combinations may need to change and adjust throughout the lifetime. In the next slide is what we're observing now. And it's become, this idea of multiple programs for multiple outcomes has become additionally important. In gray is what we had been documenting and thinking about very early on. Those of us who may have spent more time in more biomedical settings, we think, do a vaccine, prevent one infection, or take one pill and treat one illness. Even if it's a pill you have to take every day. But the data that we have been building for the last 3 decades on families that are AIDS affected, so either someone has sadly passed away or someone is sick with an AIDS-related opportunistic infection, we see a lot of these in the middle, those boxes of negative outcomes that obviously are also linked to the setting where people live and limited access to resources. But now what we've actually observed is that COVID has similar impacts, even if it may result in them in a different sequence. And overall, they still increase some of the things that we're trying to really reduce and make sure that young people can live full, healthy lives. For example, HIV infection risk or poor mental health, or early unplanned and unwanted pregnancies. In the next slide is some data that our colleagues, Leslie Gittings, Nokobonga Khalayo, and our Nabil Peterson of Interfer here in the workshop have been put together a series of research activities and now visuals to represent what young people told us was happening in their lives during COVID-19. Some of the findings are actually not surprising to those of us who are living in the communities where life was really impacted during lockdown. But these are visuals that try to bring the data together so that we can share it in spaces where programming and decisions can be made to address what young people are telling us. And one of the most basic and important elements was that even though COVID was potentially harming the most older populations, all ages, and particularly young people, were affected by the financial insecurity and hunger and the lack of basic necessities that COVID brought onto communities. Then some young people, because one can't schedule and plan everything, and because access to services was limited, were also affected because they were going through major life transitions during this time. Schools were closed, access to services like school meals, positive peer norms, information, access to sexual reproductive health products and services. They were all affected by different levels of lockdown. And so young people became parents during this time. They became infected with HIV potentially. And that transition and how these were layered during times also of intense physical risk and restrictions were really big. And the young people in our studies vocalized these. And these are visuals that we put together with the qualitative data. Mona, in the next slide, I think this is over to you.
Yes, thank you, Ilona. And just to basically dive in, that despite the challenges that we've faced over the past year or two, there are increasing opportunities. Governments have stepped in and tried to account for this disparity, this increasing disparity because of COVID-19. So for example, in sub-Saharan Africa, we can see a sharp kind of rise in social protection mechanisms and systems. So this chart represents the global growth, but in sub-Saharan Africa in particular, we've reached the highest number ever recorded of social assistance. So it's time to kind of consider how we can leverage these investments for people's well-being and to kind of keep it sustained beyond just the COVID-19 pandemic. And as we consider that, it's important to look at youth-friendly systems. And this is actually a portfolio that's been led by Ilona Tosca and Lucy Kluver, looking at the impact of youth-friendly systems that look at youth as a whole, and not just from a health aspect. So for example, when we look at the secondary transmission of HIV, it is linked to things like substance abuse, to hunger, to inequitable relationships. So it is important to address these issues when we look at improving HIV in this population. These are also a couple, I'll just walk through 3 examples of where interventions were combined in order to address multiple outcomes as opposed to just one. So this is an example from Kenya, from the Adolescent Girl Initiative, looking at the combination of educational cash transfers and violence prevention dialogues. And we do see kind of a range of improvements across three different SDGs and many different sub-indicators, as you can see. This is sort of a new portfolio of work that's emerging that looks at both kind of a wider social protection intervention combined with psychosocial support, combined with messaging, and there's literature across the region that does support this. In South Africa, Ilona's also led a portfolio of work that looked at accessible clinics in combination with youth-friendly services and how that affects adherence to ART, to how it affects how often people miss appointments, how it affects even tuberculosis and the chances that it can be protective against that as well. In Ethiopia, Will Rudgard and Selenga have also been looking at the combination of the health extension program with various other programs that promote SRH as well. So the Ethiopian health extension program is quite a unique example because it has national rollout. So this is a good example of how an add-on was basically supported where a good infrastructure exists. And this showed reduced rates of school dropouts, less child marriage, no early pregnancy. So wider benefits that are not necessarily directly health related, but definitely protective against a various range of issues. It's also important to consider equal access to care for medication and treatment. When it comes to HIV in particular, which is kind of a large portfolio of work, it's important to recognize the kind of the localized drivers of treatment non-adherence. So for example, Sia and Ilona and Lucy have been also looking at what really stops people from taking antiretrovirals. And it was acknowledged that, for example, people whose parents don't know about their HIV status had worse outcomes. People who were facing side effects because of the medications stopped taking them. And similarly, the degree of social support also affected how well they adhere to treatment. So this is just highlighting the importance of acknowledging the wider drivers. And the key way to do that is by linking care in a holistic way. So I really like the GIF on the Connectors workshop website. So this also kind of emphasizes the need for spaces like this that are able to connect people beyond just a single sector approach. So when we look at adolescent health in general, it's important to also consider a link to education, link to violence prevention, psychosocial support, improved link to social assistance, and how we can reach people living in poverty and discrimination, people who aren't traditionally included in systems like this. Thank you. I think that's us.
Thank you very much for this presentation. So again, to the whole group, you should ask your questions in the chat. For now, we have few of them that were from for Beatrice that presented just before. So there was something from Irene, actually, very good question. She was wondering, how do you keep such a huge team motivated? Do you want to take the question, Beatrice?
Yeah, that is, I would say it was lockdown. I was actually doing this presentation last night and I actually felt sick, and I can be very honest about how hard I worked. It was awful. You know, this was lockdown. I've got 3 small children, no help. It was just sort of me and my husband working day and night, trying to homeschool. And I think it was in motivation to make this country better, which is what I love about Chikalulu, that everyone there wants to make this country better. But I think by the end, we were all burnt out. So it was really, we were running on adrenaline, and I think everyone else was running on adrenaline. So whether we could repeat it again this year, I'm not sure. But that was definitely, that's how the motivation did work for that time. It really was trying to help the most vulnerable, and an absolute necessity. We could all see how harsh the lockdown was, and it was really trying to get help to the most vulnerable at that time.
Thank you so much. So before we take further questions, so first I would like to remind you all that you can put your questions to Beatrice, but also to Elena and Mona in the chat. I'm going to share a slide because we're going to be asked together to be a small exercise. You can see my screen, I hope. So yes, for you, what key change is needed to support connectors and interdisciplinary collaboration in engagement? We're going to ask you also to put that in the chat. We're very curious to hear about that. And then as you're saying that, maybe I'll go to the chat and take some more questions that have been added. Okay, there's a question from Tasha. Tasha, do you want to ask your question? Unmute yourself and do that.
Hi, everyone. Yeah, just a quick question on the evaluation and the impact measuring. Beatrice, that is a great talk, and I think like very clear that it was a mammoth task at a very difficult time in South Africa. The question I had is, it is really amazing to see the work in a really big and sort of structured program, but do you have any suggestions or advice for sort of smaller projects that maybe hadn't considered the importance of measuring or hadn't thought about it carefully and sort of get into the project and then realize it's really important, or that they have really interesting data that they're collecting? And so sort of starting measuring at different stages of the project. And any thoughts on that?
Yeah, thanks, Tasha. I was actually writing a response to Orla, who asked about in vivo and whether we had time to use in vivo to do to get the themes and everything coming out. So I think what I can emphasize in this, Tash, is that this was such a manual task. So what I was writing to Orla was that we didn't have time for in vivo. It was all done manually. So, you know, and I think, you know, I'm emphasizing here, and I think, you know, maybe it didn't come across well enough in my presentation. It wasn't, obviously we had a big team, which is obviously a big one thing, but I was pretty much doing the monitoring myself. And mine was just good old Excel and good old using my handwritten themes and notes. And I think what I can emphasize is that it's never too late to do your impact, to do your impact measurement and management. What I was trying to just get across in this is it's never too late, and it just can keep you know, guiding you as to how to do better. And I think what I always like to, you know, in smaller organizations, everyone knows so much, and it's all this information is in people's heads, and they're terrified that they're not doing IMM correctly, but they know all this information. So much of it is actually just putting it on paper. And, you know, you ask people and you say, you know, what are the key themes that you're picking up? People can just list them so easily. But I think what I'm trying to say here is that you don't need the big teams. We did in this case because there were so many food parcels to deliver. But in many other cases, it's just simple, plain tools, using your pen and paper, using what's in your head and actually just getting it out there. Does that answer, Tash, or not?
No, that's perfect. That really provides a lot of that really answers well. And I think it's useful sort of to hear from someone who's like evidently very experienced and has a lot of knowledge. And I think that can give a lot of us who are not sort of impact specialists confidence to that all of the stuff in our heads is actually data. So yeah, that's really useful.
Yes, exactly. Absolutely, yeah. Absolutely. And the people actually can do, you know, they can join in a focus group, and by the end of the day, if you ask them, they'll tell you exactly what the themes were. You know, much of it is just being more scientific in our rigor and saying, well, these are definitely themes, but it is in people's heads. And I think, you know, people are every day, you know, every staff meeting they have, they're saying, how can we do things better? A lot of it actually is just saying we're doing impact, we are doing IMM. It's just not being stated clearly, I think.
Yeah, that's really useful, Beatrice. Thank you. Yeah, it's almost part of our sort of daily work anyway, and it's just finding a way, I guess, to frame it and get it down.
Exactly.
Yeah.
Exactly. Yeah.
Okay, wonderful. Thank you so much. So I'm glad to see that some of you have started to place their commitment in the chat. So it goes from, sorry, oopsie. Okay, we have engage. So the support connector in collaboration also have a bit of, more of this kind of workshop. I could not agree more on this. There's recognition and appropriate resourcing of relationship as critical technology. Indeed. And Irene, consideration for dedicated evaluation. So that would be nice, yeah, to have all of you adding more. And I guess we all have access to the chats. And so, yes, can dig into that a bit more. That would be nice to see if there are any other questions. And in the meantime, I would also say, yeah, try to close the loop with evaluation so that it becomes engaging, participatory, and not extractive. Yes, thank you for this commitment, recommendation. Okay. That's very interesting. Maybe Sarah Kene, I would maybe you could unmute yourself and discuss a bit of what you just wrote in the chat. the key change that you would like to see? If you want to.
Yeah, it's just, I mean, so I was a work and trust engagement fellow, and I was sort of working, luckily, with lots of other engagement fellows from around the globe. And I think that there's just generally from connectors are feeling quite disheartened with the way that they get invited to speak at university, you know, and lots of my particular colleagues, you know, getting told about how their ideas and everything is absolutely brilliant. And then you literally see their ideas being incorporated into funding applications from very sort of privileged run organizations. And sometimes, you know, not even invited, or invited to be a consultant, but not invited to be sort of a lead or co-lead at least. And so much of this is going on and has been going on historically. And it's just not changing fast enough. And I think it's massively problematic. And I know people don't like to hear it, but it's still happening. And I have some very brilliant sort of Black colleagues that are doing amazing work. Again, always being invited to speak, but never being funded to do the work that they need to do. And it just drives me absolutely mad, if I'm honest. And it's, you know, we need to see that change.
Absolutely, and thank you for bringing it up. Okay, so there are some additional comments that, yeah, about donor. Jackie, do you want to discuss a bit of what you proposed? No, I'll read it. 1, 2, 3. Okay, I'll go. That donors give a percentage to monitoring and evaluation, so project strengths and weakness.
Right. Yeah. So I think one of the problems is that we do our projects, they've got a funding cycle, and then the funding cycle, I think someone's already brought that up now today, the funding cycle stops. But I think that somebody once told me, well, I think something like 20% of the project funds should go to post-project monitoring and evaluation, which means that not only are you writing a report, but you're saying this went wrong, this went right. So there's this kind of honest disclosure and encouragement for honest disclosure and what I call honest error, because we all make those mistakes. And I think that we really need to be able to share them, communicate them, and it's in the interest of the donor as well, so that, you know, next time they know better where to put a focus on the funds. Yeah. So monitoring and evaluation, I think, is just totally underestimated, and it's really, really fundamental if we're going to measure impact.
Thank you very much for sharing that. So I encourage you all to continue, please, your questions and your comments and your commitments and recommendations in the chat, as I'm going to hand over back to Chileka. Thank you so much for participating in this session, and thank you for all your ideas. And yes, please continue to place it in the chat. I think that we can interact since that medium. And over to you, Chileka.
Hi, thank you. Thank you for such a wonderful session. So now we are going to have our final reflections by Noni Mumba from Kemri in Kenya. Noni Mumba, are you on?
Yes, I am, and thank you so much. So I don't know how much time I have. I was working on very, very quickly as people were talking. Let me see if I can share this. I have rights to share. Share screen. I think it should be this one. Let me know if you can see that.
Yes, we can.
Yes, we can.
Okay, cool. So I was just doodling as people are talking. So right from the beginning, and I'll try to go over it really quickly. So for me, during Patricia's session, she was talking about what makes a good fundable project. Initially, I thought of a light bulb when she talked about brilliant ideas, a wow idea. And then I kind of changed it to a torch, because I think brilliant ideas need to be passed on, and a bulb is a little bit static. You fix it somewhere and it just remains there. So I thought, in as much as your idea needs to be perhaps new, you could also have borrowed it from a different area, or somebody else has already done that project. Try to put your own innovative twist to it, but be open for it to be borrowed, or to share it, or to pass it on to another person who can then even improve on it and come up with something even more brilliant. I think some of the things that I caught, which we do find in quite a bit of applications. I too have reviewed grant applications, not only for engagement, but for other types of research projects, using language like illiterate, backward, the people are poor. I mean, you could use more polite words like, perhaps unstable socioeconomic status, or things like that, but not use derogatory language. Clarity, what's the issue? And Patricia talked about not recycling topics, for example, that have really been spoken about over and over and over again, and yet there are others that perhaps are not getting enough airtime, if I can call it that. But people like low-hanging fruit, the easier one, the one that you can do very quickly and finish, and then leave more tougher topics. So sort of like taking time to really think very critically about what the issue is. Who are you going to involve? Don't leave out the community. Don't leave them behind. Make sure that they're very involved. So I added this like a do. I think a lot of times when we get grant calls, we rush on to put in an application and we haven't clearly thought about the project. I think we have lots and lots of opportunities for project, and a lot of us can begin to, or rather we can begin to develop some of those ideas, bounce them off a few people who are trustworthy, who will not steal your idea and take it on by themselves, and then just pack that somewhere, sort of like have an idea scrapbook, put that somewhere so that by the time you get a call for funding or a grant call, you can quickly go and look through your scrapbook. And then we went into breakout sessions where we're looking at supporting excellent engagement. Two things really jumped out at me. And the fact is that to support excellent engagement, perhaps people need to be able to work together, learn from one another. But a lot of times, like from our group, what came out was sometimes the grant or the funder is quite inflexible. The funder is very sort of like cast on stone. When you write your idea, you've written it, and there is very little room for collaboration, or people are really they're time bound, so they really just want to implement pop and finish. And so when you're collaborating, there's some slowness there, and perhaps that doesn't very augur well for doing really excellent engagement. Measuring, learning, adapting, changing, which takes me to this very last session, that is so dear to a lot of us who are doing engagement, because measuring impact and success is really just a minefield, if I can call it that. And I've just put here, I've thrown in a few things that were coming at me when people were presenting and also asking questions. I'll talk on those which are in color. I think the most critical thing that I had, what is the most pressing question? And this pressing question is, what do people want to know? What questions are the funders asking about engagements? What things do they want to come out of engagement in terms of learnings? The implementers as well, what do we want to learn? What do we want to know? The researchers, how do they, what critical questions do they want asked, which then will also help them to understand engagement and potentially also implement their own engagement activities. Continually getting better. So Beatrice and Elona kind of spoke about one thing. So I put that in one place. So you want to continually get better, and you want to, I liked what Elona said in terms of, changing the diagram of the life cycle from the baby to the adult. And at each stage, there are some things that you will have learned while somebody is a baby that perhaps you want to improve on when they're a toddler, when they're an adolescent, and so on and so forth. So for our projects as well, at each stage, what do you need to change so that you can improve that? Funds. We need funding for measuring, either embedded within the activities or as an independent fund to be able to carry out evaluation or monitoring activities. Sometimes there can be noise. I've put that as noise and trying to declutter monitoring and evaluation. You can be rushing to try and do everything and perhaps lose out on everything. Is there something that's too much data, enough data, too little data? So those are things to think about. Keeping it simple. I think this was from, was it from Beatrice when she was responding to a question? Just keep it simple. Sometimes it's really just simple things. When you go out into the field, you are doing your intervention, sit down with a pen and a paper and just be taking notes, doodling on a pad, and then come back and try to make sense of what you have learned out of that session. So thank you so much. Those were my reflections. Over.
Thank you, Noni. That was such a beautiful reflection. And now we are at the end of the workshop. Let me just share my screen really quickly. Okay. Okay, so like I've said before, the workshop resources will be on Mesh, and these will be the different recordings and the illustrations that we have so far. And just to give, again, to thank all the speakers and all the facilitators that have taken part in the workshops, not only today, but in the previous workshops we've had in September and October, and also you, the participants, for attending these workshops, because this wouldn't have been made possible without people's interest. And the series and topics that were covered in the workshop so far were via 2 rounds of consultations with connectors, with public engagement researchers and creatives. And we hope to continue these workshop series next year, and would greatly appreciate your feedback. The link to the feedback form will be in the chat. And also just to know more about your preferences for the meeting format, potential topics you'd like to cover, and also speakers that you would be interested in learning from. As a reminder, please add yourself to the Mesh community network, and that offers different services, resources, and also funding opportunities. And also that's where we share information about future meetings. And from the co-organizers, Tash from Mewoza, Helen from Mesh, and Nabil from Interfa, and also the funders, we are very thankful and hope you enjoyed the workshop series. And again, please provide us feedback via the Google form link that will be in the chat. Thank you, everyone. I hope you've enjoyed it.
Brilliant, thank you.
Thank you, bye.
Thank you, really enjoyed myself. Bye.
Bye-bye.
Good to see you, Roderick.
Bye, thank you.
Yes, Noni, great. Bye-bye.
Thank you.
Bye.